This episode of Us and Them is supported with a grant from the Claude Worthington Benedum Foundation.
Hey, it's Trey K, and from PRX and West Virginia Public Broadcasting, you're listening to Us and Them, the show that tells the stories about the things that divide Americans. Since the coronavirus pandemic began about a year ago, each day we've heard numbers tell the changing story of illness and death. COVID is now about twice as likely to kill African-American and Latino people as white people. Many people of color have jobs on the front lines of the healthcare industry or food and delivery services. Minority communities continue to face devastating waves of illness and death from COVID-19. The reasons for this disparity between minority groups and more affluent work-from-home white Americans are as old as they are complex. Health disparities are rooted in the historical racism of our institutions. Some people of color have a deep distrust of public health policies and the healthcare industry in general. So, for many, the pandemic's wrath on Black and brown people is no surprise. And many health officials agree. COVID's overwhelming toll on minority communities is just the latest chapter in a long history of being ignored by institutions designed to protect all Americans. Some African-American leaders in West Virginia have spent decades fighting for their communities to be seen and heard in a state that's 92% white. They've raised concerns about historical inequities that have not been adequately addressed. And then COVID-19 came along. State officials are starting to take notice, though the pandemic response is far from equitable. But I'm getting ahead of myself. Let's back up to 1 year ago. Our story begins in church.
Why don't y'all put your hands together? Everybody put your hands together today. Don't you let the devil ride.
On March 15th, 2020, nearly 200 parishioners from 8 congregations in north central West Virginia traveled to the tiny Friendship Baptist Church in rural Everettville. They all came to celebrate 87-year-old Pastor Laverna Horton's 6th anniversary with the church. Ramelia Hodges was there. She'll take it from here.
Yeah. All right now.
We have 2 very important ceremonies within the Baptist Church that take place every year. That is the church anniversary and or pastoral anniversary. Beginning in the spring of each year, we have what we call anniversary season. It's a beloved season that I've never seen as many people packed into this church as I had seen this particular year. You have clergymen from all over the counties, all over the region. You have important pillars of your community sitting in that church. And it just warms your heart to see them there, to see them out, to celebrate this day, to celebrate their sister. So you saw the smile on their faces. The love between them was just, if you could paint the aura, it was just so beautiful in there to see this day. There is a choir. The choir is one of our most prestigious African-American churches. That day was Morning Star Baptist Church, and everyone loves to hear this choir sing.
Don't do it, y'all. Don't let him in your life.
And you have Pastor Horton sitting off to the right in this beautiful white chair being reverenced for her service to God and to that small community. And my, what a beautiful picture that was.
Hallelujah. Amen. Amen. We ask that
Throughout the afternoon, nearly 200 people talked, sang, and shared a meal together, all within the walls of the tiny 1,500 square foot church.
The word super spreader event was not even something that was in our vocabulary, in our vernacular at that point in time.
Hodges says the group was aware of the coronavirus, but at the time there was no information about COVID cases in West Virginia. There had been no announcements from state or local health officials. It seemed like the virus hadn't yet reached the state. So Hodges said everyone at church acted like they usually do.
The first thing you do is you grab your fellow church member or your fellow brother and sister in Christ and you hug them. And you might even kiss them because you haven't seen each other. And that's what you're taught to do from a very young age. As I look back on it today, and I realize that we lost so many, that was the last time that I would ever see them.
One week after the service at Friendship Baptist Church, Republican Governor Jim Justice issued a stay-at-home order for all West Virginians. 1 week after that, COVID-19 took the life of Hodges' friend and fellow church member Viola Horton. 88-year-old Horton was the first person to die of COVID-19 in West Virginia. Her sister-in-law was Reverend Laverna Horton at Friendship Baptist. In the days and weeks that followed, more people who attended the March 15th celebration died of the virus. In all, 5 members of Hodges' community, her church family, died. For Hodges, it was as if they had just vanished.
There was no closure. There was no opportunity to grieve these people who you loved. And it leaves a gaping hole in your heart that you weren't able to properly say goodbye to them.
In those early days, Hodges and her husband also got COVID-19. They have since recovered. The schools were closing. Her 2 sons, who are 17 and 20, have a rare blood disease and were at risk for the invisible virus. Her phone was ringing with questions from community members.
Everything just kind of collapsed at that point. So it was a moment of pandemonium.
With all this swirling around her, Hodges took action. She's a professional speaker with a master's degree in education technology and calls herself a problem solver. She read what she could about the coronavirus and learned about contact tracing. She built her own contact tracing spreadsheet with the names of all the people at the March 15th church event, identifying them through videos and photos. Hodges posted her own videos to a private Facebook page.
Fam, how are you all? I hope that you're staying safe. I hope that you're staying home, and I want you to stay woke.
In her posts, Hodges shared what little information she had and asked everyone to take care of each other. Even though 2 people from the church event were the first to die of COVID in West Virginia, no one from the state's health department contacted Hodges or anyone else she knew. So Hodges called health officials in Fairmont, where she lives. She talked to Public Health Director Lloyd White and described the church event to him, and she recorded the call and posted it to Facebook.
So is there any information that you can give me? I can tell you now, there was no social distancing. There was a lot of kisses and a lot of hugs, and I am concerned.
If she wasn't coughing or sneezing or otherwise not expelling some of the viral particles, then the risk would be very low.
White said the risk would be low, but this was early in the pandemic. It was a time when even health officials didn't know much about the coronavirus. Still, Hodges was surprised by the lack of urgency.
The first call, he really didn't get it, to be quite honest with you. I would have expected from that call that he would have put out an emergency alert. He would have asked me who were those people in attendance, because I said to him I was there. I told him that I started doing the research and educating myself on what this virus was and had started speaking with a list of people who were in attendance. But he didn't ask me for that.
Hodges managed to get her spreadsheet of the church attendees into the hands of people who began contact tracing. She later learned that 30% of the parishioners who were tested had contracted COVID-19 that day. All through the early days of the crisis, Hodges' mother was in the final stages of breast cancer. She passed away in August 2020. Hodges says her mom dealt with breast cancer her way. She never had a day of medical treatment. I asked Hodges why that was.
Well, sure. I mean, let's talk about it. Let's talk about medical racism. Let's talk about a distrust for the medical community. I think it all begins with how you treat people. So if you go into a doctor's office and you're treated callously by the receptionist at the window, and then you're addressed disrespectfully by a nurse that takes you back to the room that you're going to go in, you feel as though you're being treated as a second-class citizen. And that's where we're here now. We're on a powder keg when it comes to minority health issues that has exploded with this pandemic. This was a festering wound that had the Band-Aid absolutely pulled off of it, and it began to ooze out the most foul-smelling disparity, if you would, across the nation of America. Now we see it in its larger, more present, more information available as a problem that exists. So the question then becomes not where did this health disparity come from? I think that's an insult to say where did it come from, because we knew it existed. So if you don't have a primary health care physician, you're living in poverty. How in the world are you going to pay somebody, for one, to go and get the referral, and then two, because of disinformation, you don't know whether or not you even have to pay for the test. So guess what? You don't go. You suffer in silence. You die at home.
There are 65,000 African Americans living in West Virginia. That's just under 4% of the state's population. Yet they are disproportionately represented in the state's poorest areas. In 2018, the Centers for Disease Control and Prevention did a national study looking at life expectancy statistics by census tract. Based on that data, Newsweek published a list of 50 places with the lowest life expectancy in the country. 5 of those cities are in West Virginia.
First of all, people need to know West Virginia is a small state, less than 2 million people. To have 5 places is a big deal.
That's Dr. Rahul Gupta. He's currently a member of President Joe Biden's transition team, leading the Office of National Drug Control Policy. He's a physician who recently served as West Virginia's health commissioner.
It's a big deal because what matters is what are those conditions within your area that you're living in? What is the educational attainment? What is the household income? What's the health literacy? What's your insurance status? What's your neighborhood like?
Gupta says life expectancy has increased worldwide by about 30 years over the past century. That's due mainly to sanitation, advances in medicine, and public health policies like vaccinations, seatbelt safety, and smoking cessation. But in the United States, the difference in life expectancy between African Americans and whites can be stark. This discrepancy can be traced down to the zip code. For example, Gupta points to McDowell County in southern West Virginia.
It's a coalfield area. It's also a place where we may have some of the higher number of African-American West Virginians living in the state. If you're born in McDowell County, West Virginia today, and another child is born 500 miles away approximately in Fairfax County, Virginia, the life expectancy of those 2 babies is around 16 years apart. That's amazing. You should not have that within a radius of 500 miles anywhere in this country. You shouldn't have it anywhere on the globe, this type of disparity, but it exists.
I asked Dr. Gupta how much poverty plays into life expectancy.
We should really start to consider poverty as an ailment, because unless we figure out how to help people have economic mobility to move upwards, we as a state, as a nation, aren't going to make significant progress. But that's only one leg of the stool. We need to understand that too. It doesn't begin to address access issues, the institutional and structural bias issues that already exist as well. And nowhere is it more clear, perhaps, than in the healthcare system itself. There was a report out back in 2002 by what was then called Institute of Medicine. It clearly said that with people from underrepresented minorities, even if you match for socioeconomic status and insurance status, there were still fewer routine screenings. There was less provision of pain medications. There were fewer organ transplants. So there were these biases that were happening, even if you match for the socioeconomic status. So I don't want us to think that poverty cures all ails, because it doesn't. But it is an important piece that impacts, especially in Appalachia, all populations. But still, we continue to experience health inequities that continue within the Black populations. For example, if you look at the rate of stroke, if you look at the rate of high blood pressure, rate of diabetes, the people who come from underrepresented and Black communities, a lot higher rates than non-Hispanic whites, if you look at non-Hispanic Blacks. So much worse outcomes as well.
Are white West Virginians who are poor, are they being treated in ways that maybe Black West Virginians are not?
I would like to say yes. And here's why. Let me explain that. That goes back to the issue of bias within the healthcare system. We know it exists, bias towards Black people. And the way it comes out is in data. We know that we have a significant reduction in explicit bias over time in our country. And that's a good thing to be celebrated about. But we still have this issue of what we call implicit bias. We as human beings all have implicit biases. That's not the point. It's to be human to have implicit bias. However, what's important is our healthcare providers and others in other fields take an oath to protect, to take care of, to save all lives equally. That we have to really learn how to recognize our own biases and ensure that they're not coming in to the process. Now, what is implicit bias? Implicit bias is those negative experiences that come into our mind that have been really subtle. They're part of that unintentional, unacknowledged preference for one group over the other. And they're built over time, right from very young age. So it's almost what I like to call racism without the racist. And what happens then is we make split-second decisions that are not often in the best interest of that particular patient, but they may be guided by our pre-existing biases. Those type of biases are happening all over the country every single day.
The most recent CDC statistics show that Black Americans are more likely to contract COVID-19 and are dying from the disease at about twice the rate of white people. I asked Gupta about the link between institutional bias and COVID-19.
We know what COVID has done is take the cover off the underlying racism, the underlying institutional bias, the underlying inequities in terms of socioeconomic status and other aspects of our society that pre-existed COVID. So to the extent we can, let's not blame COVID for what was happening pre-COVID. All it's done is show us how bad our inequities have been pre-existing. There's been an increase in mortality, clearly. There's been an increase in suffering as well. Exposure is another aspect. Access to healthcare is another one. So there's all these reasons. And then you add to it the issues of implicit bias and already pre-existing data that often people, based on how you look, are treated differently in the healthcare setting. It's already a setup. We should not be surprised. This was destined to happen. It's unfortunate, but there's a lesson here, which is when there are pre-existing inequities in the system, the outcomes are bad to begin with. And when one has pandemics or other challenges in public health, you're going to find poor outcomes for your most vulnerable communities.
What do you think it would take to close the healthcare disparity?
First of all, the commitment has to come from policymakers, both in state and across the country. Secondly, I think it's an intentional approach that we have to look at equity in everything. That's something that I was very supportive of and very conscious of when you're running a government agency, to ensure that there's, at least you're working towards a diversity and inclusion aspect of it. But also understanding for health providers the limits of health literacy for individuals, their background, their culture is very important to be good providers. So patient-centered healthcare is critical. Implicit bias trainings are critical. And monitoring of data. I mean, one of the things that is not quote unquote sexy, but it's very important, is we haven't been capturing race and ethnicity data in healthcare and other aspects. If you don't measure that, you won't know what those disparities are and where they are geographically.
When Gupta was the state health commissioner from 2015 to 2018, he worked with African-American leaders on statewide proposals to collect data to identify and address racial health disparities. The efforts had limited success. Coming up in the show, we'll hear from a key advocate in West Virginia's African-American community who has been on a 2 steps forward, 10 steps back journey to be seen and heard.
I believe that I've been a social fool for the last 20 plus years because I've tried to reason with logic, with thoughts, and with ideas with people in government, people in the medical profession, people in higher education. I've tried to make a case that they take a look at the health disparities that existed between African Americans and non-African Americans, and also with low-income whites. I have concluded that I've wasted a lot of time. The system is unfair, it's unforgiving, it's unjust, it is unreasonable.
That effort to get people who control health resources and budgets to see and hear the African American community continues into the COVID era. An NAACP poll shows African Americans are skeptical. By a 2-to-1 margin, Black people say they are less likely to be offered COVID testing or be admitted to the hospital. Other analysis shows that many African Americans are hesitant to get the new vaccine.
I'm 42 years old. I've heard multiple folks my age and younger say, I am not in a rush to take the vaccine. And a lot of the distrust that you'll see in minority communities look at things like the Tuskegee experiment. That's what a lot of minorities will point to.
That's after a break. You're listening to Us and Them. This program is supported in part by the West Virginia Humanities Council and the CRC Foundation. This episode is supported with a grant from the Claude Worthington Benedum Foundation.
Music lifts us up and brings us together, even when we can't get together in person. Mountain Stage brings you live performances on the air, online, and in our podcast. They remind you how it feels to be in a live audience listening to live music. This is Larry Gross, host of Mountain Stage. Find a link to our stations and our podcast online at mountainstage.org.
Hey, it's Trey. This is Us and Them from West Virginia Public Broadcasting and PRX. The coronavirus pandemic has made visible what African Americans have experienced for generations. There's a healthcare reality for white people and another for Black people. What some call a separate but equal healthcare system. Separate but equal once justified segregation in American society and institutions, including healthcare. That shameful legacy created inequities and institutional bias. Today, we see the result. harmful health outcomes, and low life expectancy. West Virginia is not a healthy state. It's number 1 in the country for obesity and hypertension, and number 2 in the country for diabetes. Health statistics for Black West Virginians are even more concerning. Black babies die in West Virginia at nearly twice the rate of white babies. African Americans in the state have higher rates of diabetes, stroke, and cancer than white people, and they're more likely to die of those diseases. And now, African Americans are twice as likely as white people to die from COVID-19.
It doesn't take a rocket scientist to figure that out.
Reverend Matthew Watts is someone I talk to a lot. He's been in a number of Us and Them episodes. He's the senior pastor at Grace Bible Church in Charleston, and he's the president and CEO of Hope Community Development Corporation. Watts has been on an epic journey for more than 20 years to raise awareness about racial disparities in West Virginia. He talked about this during a sermon he posted on his Facebook page, and you'll be hearing excerpts from that along with my interview with him. Starting in the late 1990s, Watts sounded the alarm bell with state officials. He showed them data and advocated for legislation to study and eliminate health disparities. But Watts says the calls for action have largely been ignored by policymakers.
They have failed the people of the state of West Virginia. They know how sick people are because they're coming in the hospital. They know the underlying health conditions. There's an indictment that I'm making against the executive branch of government, the legislative branch of government, the health and public health community, the higher education institutions, for their neglect.
Despite Watts' tenacity and the support of other organizations, including the NAACP, advocates say West Virginia has done little to address healthcare disparities facing the state's African American residents. They point to a state that's 92% white, with a spotty record on tackling minority health disparities. In 2007, the State Bureau of Public Health published a minority health report. It was the first time the state collected and released data on the negative health outcomes of minority West Virginians compared to white people.
Yet no actions were taken about any of these documents. And that is the theme. The theme is no matter who produced the data, no matter who produced the reports, it was the same outcome. There was recalcitrant resistance to anything that had minority in it. That's just the reality.
Since that report more than a decade ago, Watts has called on state leaders to address the social determinants of health for minority communities. Those determining factors affect the quality of our health and how long we live. They include how much education we have, our income, our job, and where we live. For years, Reverend Watts' efforts didn't garner much more than a couple of meetings and a lot of talk about what should be done. Then some movement. In 2017, a decade after the one and only state minority report was released, West Virginia's legislature passed a law, something Watts and others had been asking for years. The law created a cabinet-level Office of Minority Affairs. An important piece of that legislation launched a pilot project to investigate health disparities on Charleston's West Side. The West Side has the highest concentration of African Americans in the state. It's been 4 years since that bill became law. Yet, the pilot project never got off the ground. Watts says the few efforts the state pledged to take on have not been adequately supported with staffing and budgets.
That's what I'm trying to say when I talk about this apathetic indifference, this resistance to anything that will suggest we need to focus on issues affecting minorities. They just refuse to do it. They refuse to fund it, and they refuse to really take it seriously.
Every year since the 2017 law was enacted, Watts has come back to the legislature with ideas and data, and every year he gets nowhere. Not even a hearing.
And that's been hurtful, and it's been disappointing. And I've said for years, we have dealt with the Republicans. They wouldn't hardly talk to us. They didn't hear one thing we wanted to say. We got that. But we were disappointed that our Democratic legislators, whom we consider as friends, really wouldn't fight for us the way we thought they should have.
The coronavirus pandemic has made Reverend Watts even more determined to force the state to study minority communities and healthcare disparities.
Extraordinary times require extraordinary effort. I believe this is about life and death.
Now he wants the state to use some of its COVID stimulus money for programs to address health disparities in minority and poor white communities around the state. Watts' new proposal would dedicate 20% of that federal money, about $250 million. So far, he's received no response to his proposal.
I've been trying to show that we would do the hard work, the deep diving, the heavy lifting, and we're willing to work extremely hard to show that, hey, we'll be there to help fix stuff. We're not just talking because we ain't got nothing else to do. So this is my last crusade, and now I'm held hostage by my conviction.
I applaud him. Reverend Watts challenges those areas that folks don't often want to talk about. He goes into the dark areas. Reverend Watts pushes the envelope, and we need that.
Remember Remelia Hodges? We met her at the top of the show. 5 members of her community died after attending a large church event in March 2020. 2 of those who died were among the first confirmed COVID deaths in West Virginia. She says there was little help from state officials until she started pushing for answers.
If 2020 taught us nothing, it's that we must have these uncomfortable conversations, and we must hold feet to the fire to find solutions about what we're going to do as a society going forward. No longer can the African-American continue to be boogeyman because they're bringing up conversations about life that's actually happening to them. We cannot continue to be the, racial porn that's exploited all over the television and asked to be quiet about it. We have to have these uncomfortable conversations, and not just have uncomfortable conversations, but find solutions for them.
Hodges recently joined a statewide COVID-19 task force. Reverend Watts suggested such a group when the pandemic started to address COVID responses for the African-American community. State health officials meet weekly with faith leaders and community members like Hodges. Despite Reverend Watts' acknowledged role in pushing for the task force, he was not asked to join it. Remelia Hodges says the commission needs more representation from another key group: Black healthcare workers and researchers.
We need minority health doctors and educators on the task force. We need public health advisors who are of African-American or communities of color on the task force.
African-American social worker LaDonna Walker-Dean agrees that representation is fundamental to build trust in minority communities.
That's where it starts at, getting out there in the community, knowing who you are serving, knowing who you are helping. Because if people don't see a face, people are not going to trust what you're talking about or what you're giving.
Walker-Dean coordinates a 3-person team at Marshall University's Minority Health Institute in Huntington. The institute came to Marshall in 2017. I interviewed Walker-Dean and her colleague Georgiana Logan, who teaches at Marshall University's Department of Health Science. Though the West Virginia Bureau of Public Health sponsors the institute, Walker-Dean and her colleagues have been struggling to make an impact in the state.
I'm the only coordinator in the state of West Virginia overseeing 55 counties. I cannot do this alone. Dr. Logan is a research associate. She researches, she gets grants. If she doesn't get grants, we don't receive any funding. And so at the end of the day, I have to go out there and develop these partnerships and collaborations to continue to sustain the Minority Health Institute.
Logan and Walker-Dean say hiring minority healthcare workers can help build trust with Black West Virginians. But those specialists are hard to come by. Oh, and you'll hear Walker-Dean's 2-week-old baby in the background of our interview.
There are not a lot of Black physicians or doctors or nurses that serve in West Virginia. I don't know what that stems from. I know the School of Nursing, for an example, at Marshall University, they have not had one Black nurse in over 10 years graduate from the School of Nursing at Marshall?
Right. In the last 10 years, Marshall has not graduated one Black student nurse.
Walker, Dean, and Logan say their institute colleague, Anthony Ward, is currently researching the lack of minority healthcare workers in the state. Ward has studied healthcare disparities for decades. Despite the team's expertise, Walker Dean says no one from the institute was invited to join the statewide COVID task force that Ramelia Hodges sits on.
I wish I had the answer to why there was no representation from public health at Marshall, from public health at WVU, and from the Minority Health Institute.
Walker Dean says as the COVID-19 task force works to encourage vaccinations, building trust will continue to be essential. Nationwide, African Americans are more likely to die from COVID, but studies show they are getting vaccinated at less than half the rate of white people. West Virginia likely reflects the same vaccination disparity, but we don't know it for sure. That's because the state health department doesn't publicly release the data it has on race, ethnicity, and vaccinations. We do know that race and ethnicity data are not being collected consistently. But to be fair, data collection is an issue across the country. At the time we produced this story, the CDC reported race and ethnicity data were available for only about half of the people vaccinated nationwide. West Virginia's coronavirus czar, Dr. Clay Marsh, calls the situation problematic. He admits the state has not figured out the reason for the gap in data collection. But even with these concerns, West Virginia has been receiving national media accolades for its vaccination rollout. There are stories in the New York Times, the Washington Post, and on the national news networks.
A mostly rural state with a large elderly population, West Virginia was tagged early on as a place that might struggle with vaccinations.
This is a report from NBC News.
But now it is being held up as a shining example of what works. The CDC says the state has used 81% of its vaccine allotment, the highest in the country, while 11 states have used less than half.
West Virginia's vaccination strategy uses local pharmacists and the National Guard to give shots to its mostly white, elderly, rural populations. Missing from the national coverage? That there's been no focused plan to roll out vaccines for minority residents, who make up 8% of the population. West Virginia's African Americans are the largest minority group at just under 4%. The remaining 4% are split about evenly between Latinos and a census category called 2 or more races. With such small populations, West Virginia's minority residents were simply outnumbered by the overwhelming demand on the state's call-in reservation system. Getting a vaccine is at times determined by who you know. Maybe you'd get a text saying there are a few extra doses, asking if you can come by right now to get one. The state just didn't appear to have a plan to address the vaccination disparity. Suddenly, that changed.
Okay, hello everyone. It's
Governor Jim Justice held a news briefing about the status of the vaccine rollout. He brought up the media attention and hailed the state's good work. But Justice also admitted that the rollout wasn't perfect, and he pleaded for patience. He then introduced Reverend James Patterson.
A great man, Reverend James Patterson, is with us, and he is with us from the partnership of the African-American churches, and he's with us today in the briefing. I'll defer to our great Reverend James Patterson at this time and let him talk a little bit.
Thank you, Governor. I'm walking on water now. I've never been introduced quite like that before. But the Partnership of African-American Churches is a non-profit.
Patterson said the church partnership had a government contract to vaccinate people of color in the state's 5 counties with the largest minority populations. Patterson and his staff have a track record of providing COVID testing in minority communities.
With proper resources, we'll be the same way recognized across the country as vaccinating people of color as we are for the general population. We know how to do this, And so we will be making a dent.
Well, Reverend, thank you so much. And
again, Governor Jim Justice.
You can put this in the bank, whatever you need, and we're going to continue to do that. Whatever you need, we're going to supply, because we don't want anyone, anywhere that we have an opportunity to be able to reach out to left behind. We're not leaving anybody behind. That's all there is to it.
The governor's briefing raised a lot of questions for me. I thought about Reverend Watts and Ramelia Hodges and all that we know about health disparities. I heard the governor say, anything you need. I wondered if this government collaboration to deliver targeted vaccinations would signal a change in how West Virginia, post-COVID-19, takes on its long-standing health disparities.
You can't eliminate health disparities once and for all. Those take time to eliminate.
Dr. Ayn Amjad is a doctor of internal medicine. Since 2010, she has practiced in Beckley, one of the poorer areas in the state. Amjad was born and raised in Beckley by Filipino and Pakistani parents. In July 2020, she was appointed commissioner of the state's Bureau of Public Health.
You have to build up trust with minority populations. You have to have enough healthcare facilities in rural areas. You need enough providers. You need enough funding. You need a lot of resources. I mean, there's not a magic wand to eliminate healthcare disparities.
Amjad sees poverty as a barrier to overcoming disparities. It has firsthand impact on her patients, no matter their race or ethnicity. She says when there's not enough money for gas or groceries, healthcare and medications aren't priorities. Dr. Amjad said she contacted Reverend Watts and others when she started her job to hear what they needed. She says she'd like to talk more with community leaders like Watts about taking on one or two realistic goals. She didn't say what those could be.
Nothing is easy to fix. There's a lot of baby steps to do to get a little done. And even if a baby thing is done, you're not going to see a big spark from it. You can help a few people, but you're not going to get a big shebang out of it. But that's not the idea. So what I mean is we need people to give ideas, and then you get some more ideas, and then eventually something good will happen.
A few days after the governor's news briefing, I went to the North Charleston Community Center for the first ever minority-focused vaccination event in the state.
Sir,
Murtala Muhammad.
spell your last name for me, please.
Nurses, emergency medical technicians, and National Guard members gave the shots.
Which arm do you want the vaccine in? Which one you want to
You choose.
You want to do the right one?
You choose.
Okay, when I do this, after it's over with, you may have some soreness. Some of the side effects may be flu-like symptoms, things like that. Don't worry about it.
The local health department collaborated with Reverend James Patterson's team on this event. Governor Jim Justice introduced Reverend Patterson during his recent news briefing. That's when Patterson announced his organization, the Partnership of African-American Churches, will lead the statewide effort to vaccinate most of West Virginia's communities of color. Patterson came to this clinic as preparation for the events his team would coordinate in the coming weeks.
But ours are going to be much smaller in scope, as well as we'll have mobile units so we can go to a lot smaller communities. In the meantime, the general operation has gotten some sense of how concerned communities of color are as it relates to not getting vaccines at the same rate as the majority population. So what you see here is an effort to address that.
Patterson says the state's new commitment to vaccinate communities of color is the direct result of pressure from West Virginia's African-American leaders.
Had not some of that advocacy happened, you would not have seen this kind of an event. I'm at the point of Bill Gates' statement, what he said years ago. What are we going to do when the next pandemic comes? So what I'm trying to get people to think about, why don't we address the system in such a way that when the next crisis comes, we will have the infrastructure in place in communities of color so that this kind of thing does not happen, and that my son and my grandkids don't have to advocate for us to address the disparities all over one more time.
At the time of this vaccination clinic in North Charleston, only nursing home residents, healthcare workers, and those 65 and older were eligible for vaccinations. Dr. Sherry Young, Executive Director of the Kanawha Charleston Health Department, says the state gave permission to waive the age and other eligibility requirements for this event.
When you look at it from a medical perspective, we know that there are many disadvantages as far as being African American and having COVID. And so we look at that a little bit differently, saying that maybe that age range should be lower for the African American community because they do have more risk factors.
Man, brother. Good. How you doing? I'm doing fine, man. I'm doing fine. I can't complain.
At this vaccination event, I ran into an old friend, Mike Jones.
I just got the shot. I'm waiting 15 minutes to make sure I don't have no reaction, and I'm happy. You know, I'm relaxed.
I've looked up to Mike since I was about 11 years old. He was a standout on the high school basketball team and went on to play professionally for the Cleveland Cavaliers. These days, Mike is a musician and plays with a band. He decided to get vaccinated when the keyboard player got COVID. He also wants to protect his elderly mother. Mike says it took him a while to feel okay about the COVID vaccine.
I understand why people don't want to get it, you know, especially people of color. And that's because of the history. A lot of people know the Tuskegee experiment, okay? And it's never left the minds of people of color. It's always been there. And this has brought it out even more. And so that's why people were afraid, you know, and they don't trust, okay?
Mike says the warp speed creation of the vaccine and the chaotic rollout added to his hesitancy, and conflicting information online about bad side effects gave him pause.
In your subconscious, you're thinking like, okay, you know, so it's a lot of stuff you had to get through, and for myself especially.
Mike mentioned the Tuskegee experiment as one of the reasons he hesitated over the COVID vaccine. Tuskegee is widely seen as one of the most shameful chapters of American medical racism. It haunts public health efforts to build trust with African Americans. From 1932 to 1972, a full 40 years, the U.S. Public Health Service promised hundreds of poor black men in Macon County, Alabama, free health care through the nearby Tuskegee Institute. But the setup was a lie. Many of the men had syphilis and were never told. Worse, they were denied treatment for the sexually transmitted disease. The real motive of the experiment was to study the progression of untreated syphilis, which can be painful and can damage the heart and nerves. The Tuskegee experiment and several other high-profile cases of medical racism are not ancient history for African Americans. Martin Luther King Jr. once said, in part, "Of all the forms of inequality, injustice in health is the most shocking and the most inhuman because it often results in physical death." King's words could not be more true today. Everyone I interviewed for this story agreed that the COVID-19 pandemic has laid bare racism and disparities in the treatment of white people versus minorities that have been going on for generations. And now, fresh reporting from the federal government shows the coronavirus has had a devastating effect on black life expectancy. Reports say after 2 decades of gains, life expectancy for Black people dropped more than 2.5 years in the first half of 2020. This shocking data should open the eyes, hearts, and minds of all Americans and prompt us to redefine our institutions. There are reasons to be optimistic. President Biden's first executive orders created a national task force on racial equity, and another ensuring equity during the COVID-19 pandemic. And West Virginia is taking action on COVID-19 in minority communities with targeted vaccination clinics. But will state officials and lawmakers collaborate with minority residents to find solutions now and for the future? Will there be more focus and action on health disparities? I hope everyone will act as if lives depend on it, because they do. You've been listening to Us and Them. Our team for this show is me, Trey Kay, Marisa Helms, and Kate Smith. Special thanks to Kyle Vass and Kitty Dooley. And thank you to the Morning Star Baptist Church Choir. Michael Lipton and Tristam Lozow wrote and performed the Us and Them show music. Mark Lerner designed our logo. Lilena Price provides us with images for the web. The marvelous people at PRX and West Virginia Public Broadcasting make Us and Them possible. So do grants from the Corporation for Public Broadcasting, the West Virginia Humanities Council, and the CRC Foundation. This episode is supported with a grant from the Claude Worthington Benedum Foundation. Us and Them was originally developed with assistance from the Mentorship Program at AIR, the Association of Independents in Radio. We'll see you next time on Us and Them.
Support for this podcast comes from the Corporation for Public Broadcasting.